Why is identification of genetic markers essential before choosing treatment?
Because when you know the genetic markers, you can target the genetic abnormalities, sometimes with specific targeted therapies, with therapies that fit like a key in a specific lock. And those targeted therapies have been shown in some cases to improve the survival of the patients without much cost, without much toxicity. So I'll give you an example of this. There's a very common genetic abnormality in patients with acute myeloid leukemia called FLT3 or FLT3 mutation. When you have that mutation, there is a targeted therapy that targets the FLT3 mutation called midostaurin, and it's been shown in a very large clinical trial that the addition of the targeted FLT3 inhibitor midostaurin in combination with chemotherapy leads to better overall survival than chemotherapy alone. So you need to know that information because you want to give your patient the best chance at beating the disease. And that's why it's also important to try to get this information back quickly. No one wants to be sitting around waiting for 4 weeks to find out if they've got a specific mutation. And we've gotten better. I think medical centers generally have gotten better at getting this mutational information back to their doctors relatively quickly.
Does every patient get this standard testing?
It is. Does everyone get it? I don't know, but should everyone get it is I think the important question. Yes, everyone should get this testing. It is incorporated into the into the NCCN and National Comprehensive Cancer Network and European Leukemia Net guidelines. It is important not only because you can think about targeted therapies, but it's also important for prognostic reasons, meaning that certain mutations lead to a higher risk of relapse. And those mutations in a patient might lead me to recommend a stem cell transplant, which is sort of the most intensive thing we can do to help prevent a relapse, while other mutations, which might be, favorable in quotes, they might lead me not to recommend a stem cell transplant. So I think this mutational testing is the standard of care and should be done in every patient with newly diagnosed acute myeloid leukemia.